Good afternoon, everyone. Thank you so much for taking the time to join us. Today we have Premier Scott Moe, as well as Saskatchewan's Chief Medical Health Officer, Dr. Sakib Shahab, and SHAC Scott Kingsford. I would just ask if everyone could make sure that their audio and video are muted to make sure we don't have any interference. We'll opening remarks, and then we'll go to time for questions. Just please use the raise your hand feature if you'd like to ask a question. Thanks, everyone. Go ahead.
Is somebody's audio on? I'm getting a lot of feedback here. That's better. Good afternoon, everyone, and thank you for joining us here today. As we know, the best defense that we have in the fight against COVID-19 most certainly is vaccination. That's why our government's goal has been to get as many Saskatchewan residents as possible vaccinated. We have made vaccines widely available in every part of the province, at pharmacies, appointment-based clinics. We have opened mobile clinics across the province. We have utilized drive-through clinics, pop-up clinics, worksite clinics, as well as school-based clinics. We've aggressively promoted the benefits of getting vaccinated, the protection that it not only provides you, but provides those around you. And why we have highlighted, and we have also highlighted the serious risk that you are taking when you choose not to be vaccinated. Dr. Shahab and the Saskatchewan Health Authority have been releasing monthly data now showing that the overwhelming majority of new cases that we are experiencing in Saskatchewan, the overwhelming majority of hospitalizations and ICU admissions, as well as our fatalities, are from those individuals that are unvaccinated. Each and every day now, we provide a breakdown of the new cases by vaccine status. Most days, around 80% of the new cases are those that are not vaccinated. As a result of the widespread availability of vaccines and all of the information about their safety as well as their efficacy, we now in Saskatchewan have nearly 800,000 residents who have gone out and received their first dose. Nearly 700,000 residents have went out and finished the job. They have gotten their second shot, and they are now considered fully vaccinated. And to all of those people, I want to take this opportunity to say thank you. Unfortunately, there are still far too many people in Saskatchewan, just over 300,000 eligible residents who are not yet fully vaccinated. And that's what is driving our fourth wave of COVID in our province. Yes, there are some vaccinated residents who are still contracting COVID, but those numbers are quite low and they are quite manageable. And they have very few serious outcomes. The rise in new cases and hospitalizations in the past few weeks has been driven largely by those that are not vaccinated. Getting vaccinated is a personal choice, yes, and it will remain a personal choice. But you need to understand that that choice does have impacts on others. The choice to not get vaccinated means that you are more likely to contract COVID, and you are also more likely to pass it on to someone near you. And it is once again starting to put increased pressure on our healthcare system, which impacts our healthcare workers' ability to care for all patients, not just those that have COVID. Yes, this is a choice. This is a choice that does have impacts on others. As we move forward, we are going to see an increased number of places where proof of vaccination is required. Next week, for example, thousands of students are going to return to classes and campuses at the University of Regina, the University of Saskatchewan here in Saskatoon, as well as Saskatchewan Polytechnic. And each of those institutions is now requiring a proof of vaccination for you to attend on their campus. Our government has supported this by developing a new record of COVID vaccination on the My Sask Health Record website. That's very easy to download and it's quite easy to print off. I printed mine off the other day and it took about 2.5 minutes to access my health record. We're also in the process of converting that information into a QR code so that it can be scanned to provide your personal vaccination status if you should so choose. And that should be available sometime in mid-September. This record of vaccination can then be used by any large venues prevent the vast majority of serious outcomes, hospitalizations, and in particular, prevent many fatalities. And we can ensure that our businesses, our schools, and all of our activities can remain open and they can operate and operate very safely. Everyone just needs to take the time, make the decision to go out and get vaccinated. What's going on there, Tyler? So that's where we are today in Saskatchewan. We're not going back to the widespread public health orders and restrictions that we once had in place. That would be grossly unfair to the vast majority of Saskatchewan residents who have made the right decision and who have went out and gotten themselves vaccinated. But we do need to do more to encourage, yet again, more people to get vaccinated. In the future, in this province, it is going to become more difficult to attend certain events, yes, and to take part in certain activities if you choose not to be vaccinated. You need to know that. You need to know that today, because your choice does have an impact on others. So let's finish the job and let's finish it together. If you haven't done so already, please go out, make your appointment at a pharmacy or one of our Saskatchewan Health Authority clinics. Get your first shot, get your second shot, and ultimately that is the way we will stick it to COVID, and that is the way we will drive the numbers down throughout this fourth wave. Dr. Shahab, you have any comments?
Thank you, Premier. So I just want to take this opportunity to